Do you know the signs and symptoms of breast cancer or the risk factors? October is Breast Cancer Awareness Month, and in this video I'm going to talk you through the signs, symptoms and risk factors that we older women over 50, over 60 need to be aware of, because it is a disease that affects mainly older postmenopausal women. So October's Breast Cancer Awareness Month, and in this month alone around 5,000 people will be diagnosed with the disease, most of them women. Now the good news is survival rates have improved massively, but there are still thousands of people around the world, mostly postmenopausal women, dying from the disease. So what can we do about it? Well, the first thing is to know the signs and symptoms. So there are many different signs and symptoms of breast cancer. So the most important thing is for you to get to know your breasts. So that means having a really good feel, touching them, looking at them and checking them to see if you can find anything that doesn't feel or look normal to you. So some of the signs and symptoms are these. It might be a lump or a swelling in your breast or in your upper chest or in your armpit. The breast might have changed its shape a little bit. Maybe there's some puckering on the skin above your breast or on top of it. Maybe the breast looks a different colour, maybe it's a little bit inflamed. Or you might have a rash or a crusting on the nipple. Or there might be some discharge from the nipple. So I find it easiest to check my breasts either when I'm in the shower or when I've just come out, when I'm drying myself. It only takes a few minutes to check them, and make sure you check all over your chest and under your armpits as well. Now there are lots of different causes of breast cancer. There's no one single cause. It's caused by a combination of factors, the way we live our lives, our genes and our environmental factors as well. So what can we do to reduce our risk of breast cancer? Well, there are three things that we can do. We can limit our alcohol intake, we can eat a healthy diet, and we can keep physically active. And let's talk about screening or mammograms. Now in the UK, you are invited for a mammogram every 3 years from the age of 50 to the age of 70. And after that, you have to request it, but it will still be free. In the US, it's recommended that you get a mammogram every 2 years from the age of 50 to 74 if you are at average risk of breast cancer. In Australia, you're invited every 2 years for a mammogram from the ages of 50 to 74. And for under 50, so from 40 to 49 and over 74s, can request a mammogram, but they have to request it themselves. Now, I know there's been some controversy over screening over the last 20 years or so because it can result in potentially unnecessary surgery, but I would much prefer to be screened on a regular basis, and if the worst came to the worst and they found something and the biopsy was done and it was found to be benign, I'm quite happy with that. And actually that did happen to me because over 30 years ago I had a benign breast lump in my left breast. It was quite painful. I didn't know anything about breast cancer at this point. It was in the mid-80s. It was shortly after I'd had my son. And I went to the GP and he said, oh, it's probably nothing, come back in 6 months if it's still there. So I said yes, which of course I would never do now. Anyway, happily, I eventually did go back because it was quite painful. A biopsy was taken and it was discovered just to be breast tissue, and so they removed it and everything was fine, and I've been absolutely fine since. Now I just want to touch on HRT and breast cancer. I'm not medically qualified, I'm not a scientist, but I have looked into this because I have recently started to take HRT and I've decided on balance that it's safe for me to do so. Now I'm going to put in the description box below the articles that I have relied on, as well as talking to medical professionals and the doctor that prescribed me my HRT about the risks of taking HRT and breast cancer. Now the main thrust of the most recent research into HRT and breast cancer says that the risk is very small of contracting the disease, and the risk is far outweighed by other risk factors like drinking too much or being overweight. Now there are certain risk factors that we can't change, and these are being a woman. 99% of breast cancer cases are in women. Getting older, 80% of cases are in older post-50-year-old women. Most cases of male breast cancer are in men over 60. And finally, a family history of breast cancer. If there is breast cancer in your family, particularly your close family, you or your family may be at higher risk. Now, if you want to find out more about breast cancer, I'm going to put some links in the description box below, because they are the organisations with the most robust research that is peer-reviewed, that you can count on to be as reliable and as up-to-date as possible. But of course, you must do your own research and come to your own conclusions. I used to work for what was called Breakthrough Breast Cancer and is now part of Breast Cancer Now, the largest breast cancer charity in the UK. Now, part of my role as head of community fundraising at Breakthrough was to look after our fundraising groups, and our patron was then Prince Charles, now King Charles, and he would invite our groups regularly to Clarence House and St James's Palace to receptions where he would welcome them and encourage them and talk to them. And as you can see from this photo, I was lucky enough to meet him on one occasion at Clarence House. Sadly, the tall blonde woman in the photo, Sally Belch, died a few months after this picture was taken, leaving behind a young family and a husband. So, the 3 takeaways from this video during breast cancer awareness are: get to know your breasts and what's normal for you. If in any doubt, check with your doctor, and stay healthy by drinking in moderation, eating well and staying active. So let me know in the comments below, does any of this resonate with you? Do you go for your mammograms regularly? Do you check your breasts regularly? And thanks again so much for watching. It means the absolute world to me. And I'll look forward to seeing you on my next video. Bye.